recurrent urinary tract infections. I'm here with my colleagues, and I think we've had the chance to speak with them. So thank you for having us. And won't go into detail on some the epidemiology of UTIs because I'm certain you know a lot about them. All we know is that UTIs affect more than 50% of women at a time in their lives. So what I'm going to talk about is the product and how we came about it and what it does. So basically what we're saying is instead of using some antibiotics which are not working very well, we should focus on non-antibiotic remedies. For example, D-mannose. And here we have a formulation which has both D-mannose and vitamin C. And we've seen that in the past, some antibiotics are not really working so well. So, and in Tanzania, for example, over the past year, 11% of all hospital diagnoses were UTIs, and about 40% of them led to hospitalizations, meaning that the current solutions are not working so well. So with that, we are working to consider other solutions. For example, there is this D-mannose, which is an epimer of D-glucose. The difference is that there's an OH group from glucose, which is turned the other way, making it D-mannose. D-mannose is readily available in our lives, in vegetables, in fruits, and that's why maybe mama says sometimes when you have UTI, maybe take lots of papayas. So that's one of the examples. There are some studies done. This trial was done in 2020, 2022-2023. It was randomized, and it showed that D-mannose worked better than some placebos, even in comparison to an antibiotic which was used in management of UTIs. This is another study which showed that D-mannose was as comparable, and in some cases much better than antibiotics in management of recurrent UTIs. So this is an advantage here, and in some cases you can also use it in combination with antibiotics. This is the mechanism of action. So here you see that the epithelial cells have mannose-related proteins. So what you do is provide an exogenous source of D-mannose, and this allows for competitive inhibition where E. coli attached to D-mannose, they're washed off from the urinary tract. So there is a study which was a review actually, which shows that D-mannose is as effective as nitrofurantoin and with much better outcomes on side effects. So our product is in combination with vitamin C. Vitamin C has shown to force the bacteria to create nitrous oxide, which makes the bacteria or the uropathogens say break. So this is our product. We have it in a number of hospitals and pharmacies across Tanzania. You can also reach out to us directly. We can provide it to you or direct where to find it. The retail price is about 35,000 for the large bottle, which is a monthly bottle of 120 tablets, and the retail price for the smaller bottle is about 15,000 for a weekly dose of 28 tablets. So usually somebody takes 2 tablets in the morning, 30 minutes before a meal, and 2 tablets in the evening, 30 minutes before a meal. You can take it with anything. If somebody is taking, although you don't advise, but even someone is taking alcohol, they can still take it. So it can be used in a variety of cases or situations. Thank you so much. Kama kuna swali lolote, niko tayari kujibu. Na colleague wangu hapo Tina, na colleague wangu hapo Noela wako hapa. They can also provide responses to any question today or any other time. Yes, sir.
Okay, thank you very much, just for the good presentation. So for how long are you going to use the manus plus vitamin C?
Great question. Great question. So we've also had this question for a number of times. So what we say is that if somebody has uncomplicated UTI, you can use it for 5 to 7 days. Usually within the next 48 hours, if you're using accordingly, the quality of life starts improving, and bacterial resolution, the situation gets better. But we suggest that you use it up to a week. But there's some people who have had recurrent UTIs, highly complicated. So you suggest that you can use it up to a month. But also there are benefits to using this combination. There's been cases, we've been collecting data, and what we see is that people say, because of a combination with vitamin C, their skin health improves. They also states that their vaginal health, because of also improves. Vitamin C in combination with D-mannose improves the collagen formation in individuals. So this is the benefit. So apart from the treatment prevention benefit, it could become a lifestyle product. So someone can use it continuously. But for management of UTI, within 2 to 5 days, somebody's already started clearing the issue.
Well, I have a question, not a question. Actually, yesterday we have talked about the new study that has been published just on the 8th April of 2024, that they are saying that D-mannose, it does not work anymore in preventing UTI. So you suggested that you should do follow-up in our community to come up with some other result. But it has been published in this JAMA network, and it say that 2 grams, they give, it was an RCT double-blinded study with the 1,200 women were receiving, 600 of them, they were receiving 2 grams for the past 6 months, and it did not prevent the UTI or recurrence of UTI. So maybe if you can come up with some data in our setting.
Yes, that is a good observation. I think we also followed into that. I remember our discussion yesterday. And it's just one of those, many other articles. Most articles that we've seen, even the one I showed, show the resolution with D-mannose. However, in our setting, we've been collecting data, from the subjects that we've been working with, have been using it, and they show positively that it's supporting them. I think you can say in the same way that some antibiotics are not really working for some people and some working for some other people. However, we've already put together a proposal for a study which is going to be in collaboration with MDM Urology Hospital and Muhimbili Hospital. So, and with that, I think, as you mentioned, you mentioned correctly, we should collect data based on our setting, and then we can use that maybe in other additional studies to really say confirm whether, or rather check whether it works or not. But so far, based on the subjects that we've been working with, majority of them have been having improved quality of life after using D-mannose, and previously they had challenges when they used some antibiotics. All right, thank you so much. Looking forward to interaction in the future. So hopefully we get further support going forward.
So we'll have a short one for the last sponsor, and then we'll have a late lunch, and then we are expecting to have a dinner at breakpoint. At breakpoint, which is around makumbusho. So, and at that particular gathering is where we will receive our certificates. So we are all welcome in the evening party.
Habarini za mchana tena. Nimepewa privilege ya kuzungumza dakika chache tu kama 5 hivi. Kwa nitaomba basi nitumie hii nafasi. So I will given about our product in the morning, but I want just to talk about what we do in our company. So at iFighters, we really want to leverage artificial intelligence and all sorts of risk simulation to unlock and revolutionize the healthcare system through designing of safe, better, and more precise or personalized medicine. So we are eagerly to develop more personalized medicine in the future. And so whatever we do, our value is more into focus into customers, so we are customer centric, and we use a lot of computers to design our medicine, including our first product that we have already developed for the BPH, but also now we are working into other disease. So this is our drug discovery pipeline with several other medications that are on track for treatment of other indications. So I will not talk about others because we are still in the pipeline for drug discovery for different indications. We already talked about in the morning, just maybe to remind that our first phytothela, Urifito, is available and in some pharmacies across the country, and it has been shown a very good promise and has been working with the 3 distinct mechanisms: reducing the prostate volume, enhancing optimal flow of the urine, but also improves the libido and addresses issues of erectile dysfunction. So thanks a lot, and I would wish ask for the collaboration. Remember yesterday some of our colleagues was talking about artificial intelligence for PSA diagnosis. It is something, of course, we can collaborate and also we can work on it. It is not straightforward, but I'm sure we can do and we can work. This is the area we do, and it's our area of specialization. So thanks a lot. Asanteni sana.
Jamani, karibuni kwa late lunch.